Good evening. I'm here today to talk about a specific learning disability some of you may or may not be familiar with, auditory processing disorder, also known as APD. This condition is where the brain has trouble processing auditory information, making it difficult to understand verbal instructions or conversations despite normal hearing ability. Today I want to discuss how this will affect our young learners, kindergarten through third grade. Some characteristics that can be visually noticed on children with APD are difficulty understanding speech in noisy environments, such as classrooms, even though their hearing ability is completely normal. Problems following multi-step oral directions, needing increased time to respond to oral information. In addition, and not limited to, difficulty locating sound sources, poor auditory memory and recall, and confusing similar sounding words. Some known causes of APD are neurodevelopmental issues, ear infections, neurological damage, and auditory deprivation. How do we diagnose APD? Many cases, there are many tests that are involved. Some begin with one positive result and then following further assessments. Some may include speech perception tests, hearing tests, auditory and processing tests, language tests, cognitive tests, questionnaires of parents or the guardians with their experiences and concerns of why these tests are actually being done, and the child's medical history. How can we make an inclusive classroom for those children with APD? Modifying the environment is very important when you have a child with APD in your learning environment. Some things can be modified to make it that their environment is the most beneficial for them and the other children in their classroom. One thing to start with will be the child to sit closer to the teacher or instruction in the classroom. Moving their seat closer will enable them to focus on what the teacher is saying by lip reading, in addition to eliminating excess noise that may be causing a distraction to their student. Reducing those background noises can also be established by closing the doors and the windows in the classroom. Improving acoustics in the classroom is also important by applying many mats or carpeting down in the classroom. Those will absorb those sounds that are causing distractions for the students. In addition, you can put curtains or caulkboards up. Implementing a quiet environment is beneficial for these students with APD, and maybe implementing in a special area of the classroom a quiet work zone. In this quiet work zone, it is a bubble, in a sense, for these children to feel safe and have their own time to do independent learning or practicing a skill of that lesson plan. Supporting these students with APD is obviously very, very important. Technology and assessment accommodations can be made, visual reinforcements, incorporating manipulatives, hands-on manipulatives in the classroom for all subject learning can engage multiple senses in the lesson. Collaboration also with audiologists, speech pathologists, and their parents and guardians. Establishing the relationship with these individuals will enhance the child's learning experience because you will all be on the same page and be able to have a team with each other working towards the same goals for the best benefit of the child. Thank you.